Good afternoon, everyone. This is County Executive Pat Ryan, joined by my esteemed colleague, Dr. Carol Smith, our Commissioner of Health
Good
and Mental Health.
afternoon.
Thanks for being here, Dr. Smith.
Oh, thanks for having me.
We're going to keep our masks on, so hopefully the sound is not too muffled for everybody. But of course, we want to continue to be safe, especially given what we're going to talk about here in a minute, which is still much higher rates of COVID than we would like to see right now, to put it mildly. I'm going to start, as always, with the numbers, and then we'll kind of transition into hearing from Dr. Smith. Starting with our current numbers in Ulster County, total cases cumulatively now at 12,602. Total tests completed 310,000 plus, 10,499 recovered, and unfortunately another 2 fatalities just in the last 2 days. So as we've seen the wave of active cases and positive cases grow, we've also started to see hospitalizations creep up, and unfortunately fatalities continue. Just again, a reminder of why we have to get ahead of this and slow down the new infection rate to prevent this tragic loss of life. Hospitalizations, unfortunately, are back up, or increasing anyway. We are now at 14, and you can see on the graph the beginning of an increase back up somewhat. Hopefully we won't get anywhere near the levels we had towards the end of 2020 and beginning of 2021, but that is unfortunately increasing. I want to start the deeper conversation with you, Dr. Smith, by prompting the chart of our active cases right now in Ulster County. So this graph shows a pretty clear visual of really what is happening right now, where we had, of course, our first wave. We got it under control. We had a much more vicious second wave, and we thought, and hopefully still think, we are on the downswing, but you can really start to see now the beginning of that, either a potential sort of wave 3, or even us just not fully coming out of that second wave as much as we hoped and worked to do. So 1,861 positive cases active in the county. Dr. Smith, can you just kind of talk about what you think is driving that? Of course, we're making headway on vaccines, but this could be a real problem if we can't get this under control.
I agree. There could be a number of factors really going on here. I think one of them certainly is the fact that now, with the onset of the spring season, of having experienced a year of COVID and the kinds of restrictions that we've had to live by to survive, basically, to reduce our number of fatalities, et cetera, folks are letting their guard down, I do believe. We are seeing in the department some complaints, which people will submit to us, of folks not wearing masks, of congregating, of having group parties, et cetera, at various places. And, we do understand the fatigue factor. We understand the need to socialize. We understand now that people are outside more because the weather is better. However, it's still the behavior that's probably the number one driver of this issue, where we, and in fact throughout our region, in the Mid-Hudson region for sure, are starting to see that slow increase in numbers of cases. And, one thing that's important to remember is that the number of active cases precedes, unfortunately, the number of deaths and fatalities. The number of deaths is actually the lagging indicator behind the increase in number of cases. So, that's of tremendous concern. And, even though we're anxious to get normalcy back as we have known it in the past, we understand parents are anxious to get children back to school, back to sports practices and team type activity. We understand that, but those numbers of cases are presenting themselves, positive cases, in school teams, in still across every jurisdiction in terms of our school systems throughout the county. We are seeing it in businesses. We are seeing it in, various sectors of the community. So we know that the community spread certainly is going on. And, the percent positivity rate for our Mid-Hudson region right now is 4.76%, which is, Long Island is pretty much there as well. But considering all of the different regions across the state, it's the highest, unfortunately. And we don't want to have that happen in our region. We know that, tourism is very important to this region. We know that our economy is driven by the outdoors kinds of activities. We know folks are coming up from the city. We know that, there's a demographic shift going on as well. People are leaving urban areas to come to areas like ours. But, the fact of the matter is that if we let our guard down, we're going to pay the price for that. The other thing that certainly needs to be kept under consideration is the fact that, the virus mutates. It's been mutating since day one in its entry into this country. We have seen various mutations which have gotten different kinds of labels now, which they're basically genetic mutations.
So this is when we hear the term variant.
Variant,
that's the same
exactly.
term.
Mutant, variant, it's synonymous. And what happens is the virus changes to benefit its own survival is really what's going on. It's a kind of an evolutionary thing that these viruses undergo. And the mutation that is most conducive to the spread and survival of the virus is the one that's going to be the most prevalent or the dominant. So right now, the dominant variant that is spreading across the world and the United States, all 51 jurisdictions in the United States territory, in the Americas, the UK variant is the predominant one. And, there are others. There's the South African variant. There's what's called now the New York variant, the California variant. These are just tags that are applied to it. They have other kinds of numerical names as well. But essentially, they're mutations in either the DNA structure of the virus or the spike protein on the virus, which will enable the virus to spread more easily. And that's certainly the concern is that once that virus achieves the ability to spread more readily, that, it will do that, and that could very well be one of the reasons why we're seeing an increase. The numbers that are being reported right now are basically, everyone agrees that they're really underestimates of the numbers of circulating cases of the variants. And the reason for that is that it's a very intricate process to sequence the genome of a virus. So, it takes some time for the laboratories to be able to do that sort of sequencing to identify the variant. And what the CDC is doing is now really basically amping up its ability to sequence. And there's a consortium of laboratories, academic labs, commercial labs, state health department labs that are all amping up their ability once the genome has been identified now to start testing for the variants in the test samples that they're receiving. So to date, we have documented 5 cases of the UK variant in Ulster County, and we have 1 case of the New York variant in Ulster County that's been documented. But again, because of the transmissibility of these variants, we're all assuming that there are many more cases out there. And, it's going to take some time to really get a handle on how many and what the consequences of these particular variants are going to be with respect to the clinical manifestations. Who is going to suffer more severe consequences of the virus, et cetera. So that brings me to my message, and I hope to really underscore it in this presentation. We have to stay vigilant. we have to continue to wear the masks. We have to continue the 6-foot social distancing as best we can in as many circumstances as we can manage it. And, as not let our guard down. And that's really the message that I think we really need to drive home to our community right now.
So in my my non-doctor read of this, if I'm hearing you right, Dr. Smith, is the COVID hits. It's obviously devastating a year ago. We do a bunch of things to get our guard up and our vigilance up, and then the virus does what viruses do, and it adjusts and it morphs to try to kind of overcome our measures. And so that means we now need to adjust, right? We need to recognize that this is a kind of a back and forth, and we can't just keep assuming that things, maybe just because they were okay in the summer, we're in a very different situation now. So even though we have all these reasons for optimism in terms of vaccines and in terms of improved treatment and better testing, the virus has a say, and if we don't keep our guard up, and in fact even maybe redouble our vigilance, we could be in a really dangerous situation where just when we're about to hit critical mass on vaccines, we have these new variants, and that's obviously the opposite of what we want to happen.
Exactly. But it's still, we still have to continue to support vaccination. That's still going to be our best tool to get ahead of the virus, get ahead of its ability to spread and mutate, and, to protect ourselves from getting ill from it. And again, though, even in the best of circumstances, remember these vaccines have been made available through what's called an emergency use authorization. And what that essentially means is that it has been approved because of the urgency of the situation, and they're not really fully licensed. It doesn't mean they're any less effective. It's just the process has been sped up so that they can get out there and start doing what we need the vaccines to do. But, even in the best of circumstances, after 2 vaccines, say for the Moderna or the Pfizer, which are 2-dose vaccines, we get 94% efficacy, which is great. But, the point of the vaccine really is to protect the recipient of the vaccine. So we still don't know if, for instance, if we're fully vaccinated, if we were to come across the virus and, so to speak, be a carrier, we may not get sick from it ourselves because we've been vaccinated. Potentially, we may be able to transmit it to somebody who's very susceptible. So that again circles back to the message that we still have to do the social the 6-foot distancing and the mask. But certainly the end goal is to save lives, and that's where the vaccine is going to make a major difference for us ultimately. And the more we have vaccinated, again, the lessening of the spread, relatively speaking, and therefore we're sort of getting on top of that virus's ability to mutate.
Right. And I think to ask, just to follow on that, I'm sure the question many people would have is, if I've been vaccinated, what is the risk? And we may not know the answer to this yet, but what is the risk from the variants? My understanding is that at least the UK variant, most researchers believe that the vaccine largely is effective against at least the UK variant, which is by far the most prevalent variant. But can you talk a little bit more about that?
Sure. The variants now, remember, we're only a year into this pandemic. And I think what we've done in terms of scientifically being able to figure it out, to, study its various genomic or genetic makeup, it's the kinds of issues that present with respect to its transmission in the community, all of that. We're learning literally on a daily basis, and we've learned a lot. But you're right, one of the things that we're concerned about with these mutations is, for instance, with the UK variant, we've been grouping them into what's called a variant of interest, a variant of concern, and then there is a third level, which is, one of sort of an emergency kind of situation because it's so deadly. But the UK variant is one of concern, but when they looked at the changes in the various genetic components of the vaccine, of the virus, in the variant form, we feel that the transmissibility ability is great, but its susceptibility to vaccination and to some of the treatment modalities, there may be some moderate changes, but not to the extent that it becomes, a very lethal form. Potentially it's lethal, but it's still not the most lethal of the potential genetic changes that could happen. And what I mean is the virus could so change that it becomes resistant to a vaccine.
Right.
And that's a tremendous concern.
But we don't think that that's the case.
It's
right now.
not the case right now, and we do know that the pharmaceutical firms that have developed the vaccines know this, and that they're studying these genetic variants, and they're, if they were to need a booster or what have you, that would be something that right now they're, getting information on so that they can be prepared if that becomes necessary.
And my understanding is, let's take the flu, for example. This is actually the normal course of things. You develop a vaccine, the virus mutates, you develop a booster. Right. So this may be a multi-year thing where
it potentially could be. The flu, for instance, what they do is they look at the flu as it presents globally. So if it presents in one way, or the different strains of the flu virus present, say, in the southern hemisphere at one part of the yearly cycle, they can say, well, presumably that's going to be the set of variants, again the word, that show up, say, in our country. So the flu vaccine, that's why we need to take it on a yearly basis, gets modified so that it really takes that into consideration as to what is the most prevalent circulating strains of that flu virus. So the same may happen in this case, and we'll learn that as the days and weeks and months progress, but that is within the realm of possibility.
I think that's both initially feels like, oh man, but at the same time, to me, that's actually encouraging because we've done that before. That's something we're used to doing, and so
yes.
There's a protocol. This is
Yes.
we go back to the science and to our experience. So
yeah, and let's face it, we've learned a lot over the past year in terms of a coronavirus, how it it behaves from a global standpoint. This isn't the first coronavirus that we've experienced. There was SARS, there was MERS, and in the past, and we were able to control the spread of that and the deaths, et cetera, associated with that. This particular time, the coronavirus, COVID-19, really got out of control and got ahead of us. So that's the concern moving forward, that we don't let that type of thing happen again, and that we be more proactive rather than reactive as we were over the past year.
So my ultimate takeaway, and then we'll start moving on here, is that as much as we don't want to hear it, maybe, putting on masks and maintaining distancing and avoiding gatherings and washing hands may be even more important now than it's been at any time, because we're at risk of either one path is we keep that in check, we get vaccinated, and we get through this. The other path is we let it come back and
again.
Yeah.
Yeah, and watching its, how this is sort of, rolling forward in the different regions of the state, where other regions were a little higher than ours for a while. Now ours is the highest, and that's concerning. We're in a region where we have, a lot of, it's heavily populated in the Mid-Hudson region. We're so close to New York. There's so much traffic between us and the city, us and the, contiguous states, New Jersey and whatnot. And, it's, it's no surprise that now we're experiencing this, and but doesn't mean that we can't we can't get ahead of it and control it.
And that we
I'm
can't
very
do-
confident we can.
I am too, and I think we've shown our ability to do that, right?
Yeah.
Look at that graph where
Yes.
we did it once.
Yes.
Now we just need to do it again. And I think,
Yeah.
we've talked about, for example, that we actually think there is, even in the midst of this, a way to safely get schools open as long as we follow precautions. And there is a way this coming weekend, if you're celebrating Passover, and the following weekend, if you're celebrating Easter,
Yes.
there are ways to still safely do that. Can you
Yes.
talk a little bit about
Yeah.
how we can do that? Because I think that's a critical window here where we could either get this back in check or see it spike like
Well,
we did
you're
in the winter.
absolutely right. I mean, it happened after the Christmas and Hanukkah holidays where we experienced then that huge uptick. And, we certainly, I think we can do it safely. But again, remembering, rather than hosting these large, parties or get-togethers, to limit that. So it's not to say that you can't be with your closest family members or what have you, but remember that, it's still our responsibility to protect the older folks in our families and community, and, just be mindful of how we go about doing the celebrating, and making sure that, even if it were, within a church or a synagogue or whatever, that there is some spacing. Hopefully 6 feet is still the gold standard, but, and with a mask, but it doesn't mean that you can't be together. It's just how you are together.
Right.
And the kinds of, the kinds of social, and again, masks are becoming so much more a part of our daily lives. Sometimes we forget they're still even on, but, to wear it to protect our loved ones for sure. And, outdoors activities, because of the fact that it is outdoors, are basically safer than indoors. Having good ventilation indoors, good ventilation systems indoors is better than not. So, get outside, take a walk with your loved ones, have maybe in the yard or whatever, but, just try not to be in a confined, closed space, having a lot of people in that closed space, and not using the mask and whatnot when you're celebrating. So it's important.
Great. So
Yeah.
I'll continue to drive through the updates here. We may have a few more
Sure.
items to hit too. And the next piece here is our daily new positive rate. You already talked about that, Dr. Smith. We've seen consistently, and again, a clear visual of the number of new cases we're having each day. We're approaching that upslope or incline that we don't like to see on the number of new cases in the last few days here, approaching close to many days 100 cases, new cases or more.
Yeah.
We still remain between 5 and 6% new positives in the county. The region is around, as you said, 4.5. And that is just much higher than we can sustain to get this in check.
Yeah.
The cumulative case projection essentially remains the same and is within our control to sort of pick our destiny there in terms of following the precautions. Hospital capacity, I talked about this. We are, as Dr. Smith said, this is more of a lagging indicator. We're currently at 14 hospitalized, 1 in the ICU. We're not concerned at this point about capacity, but of course we're always watching that carefully. And once again, we'll put it up on the screen. Dr. Smith said it. I'll reinforce it, but we cannot reinforce this enough for ourselves, for our loved ones, remembering to follow the precautions of masks, distancing, hand washing, and avoiding especially those indoor gatherings for extended periods of time. It's a big ask, but it's a small sort of price to pay for making sure that for the next few months we can just keep these numbers down.
And get the vaccine. by
Well, right.
all means, get that vaccine. But the vaccine needs the support of the behavior that we just outlined in order to be most effective. It's not going to do it alone right now, but it's going to be a major step forward in what we have now as a tool to, help us to get ahead of this virus for sure. I can't say that enough. They're safe and definitely something you should do.
And from the data we're seeing nationally and even here in our region, the first places that we started vaccinating, especially our senior facilities, it's been crystal clear data in terms of how effective the vaccines are. We've seen the highest risk places, our senior facilities, go from high risk to now virtually no cases because of the efficacy of the vaccines in these congregate settings.
Absolutely.
You look at the data from Israel, where they've really had a very rapid rollout, and they've seen cases just plummet.
Yes.
So we just need to your point, hold on a little bit longer until we can get, right now we're about 30% vaccinated. We need to get that vaccination rate up, and we need to buy ourselves some time.
Right. And now, there are various channels in which you can get the vaccine. Those are expanding week to week. More and more of the pharmacies are coming online. Doctors' offices will be receiving the vaccines. The production of the vaccines is going up. J&J, the Janssen vaccine, is going to be much more prevalent. That's the one-dose vaccine, which certainly makes things a little simpler from that respect. And, so there will be lots of opportunities. But right now we have our point of dispensing pods, we lovingly call them, vaccination opportunities. Right now one is running today and tomorrow at the Best Buy. And, they're all appointment-based for sure. And we have great, I think, receptivity on the part of our community to these vaccines, which is very rewarding. And there's a state-run site down in the New Paltz area at the fairgrounds. So, we'll be seeing more and more opportunities for sure. But right now, the sooner you get it, the better.
For everybody.
So take advantage of what is currently available and by all means get the vaccine.
And I'm going to quickly just repeat some of the details on vaccines. This is not a lot of new information from our last update, but for this week, as Dr. Smith said, the county's been allocated 4,170 doses to the county, plus the supply at the state site. So that means over 10,000 doses this week alone, which is an order of magnitude more than we were getting a month ago, thankfully. Our different pod locations, the county pod is at the Hudson Valley Mall, the former Best Buy location. You can see our other dispensing partners here, and we want to continue to thank them, and we will see this list also continue to expand. The total statistics in the county continue to be very encouraging. We now have 53,522 Ulster County residents that have received their first dose. I mean, if you asked me a month ago
I know.
if we would be that fast.
There's that 50,000.
Yeah, so that's to cross the threshold of 30% is very good news. But again, we need to get somewhere to 70 to 80% before we can feel much more comfortable about the total population. So we have a lot of work still to do, so that is coming. If you need to still be vaccinated, which 70% of you do, hopefully, want to be and are ready to be, there's two places you can go. The first is to our vaccinateulster.com webpage to sign up for our county site. You can also call, if you don't have internet access, you can call 845-443-8888 to our Recovery Service Center. Many of Dr. Smith's team are staffing that, and our other county teams staffing that number. And then in addition, you can go to the New York State Am I Eligible page to sign up at the state sites. The other thing that I want to just continue to put out a call for, we do need folks to continue to work at our county pod sites. We've counted on a few hundred incredible volunteers, some of whom have literally been there every single day. But they're getting tired. They need some relief. And so we are asking for more people to help and to serve. We are now offering a stipend a pretty generous stipend for both medical and non-medical volunteers. So you can go to ulstercountyny.gov/volunteer and sign up there. And even if you do one shift, beyond getting some compensation, which we could all use, and you've been there way more than me, Dr. Smith, but seeing the literal tears of joy from your neighbors and friends as they're getting this life-saving vaccine, that is a pretty rewarding experience as well.
Very rewarding, yeah.
So even
People
to
are
just
very happy to
Yeah.
get it, which is wonderful.
and just doing one shift to volunteer there would be a huge help. So please sign up if you're able. We have weekday and weekend opportunities to do that. As we wrap up the briefing, Dr. Smith, I want to thank you personally. It's been over a year now. I still remember March 8th of 2020, Sunday.
We'll remember that for the rest of our lives.
Coming in, yep, and being able to look to you and your team being ready with a plan has made a huge difference and saved lives here in the county. So thank you for that. We're not done yet, but
Right. Thank you.
one day you'll get to have a day off here, hopefully soon. So thank you, a special thank you to your team of public health nurses and the whole health department and mental health department that have been working around the clock. Thank you to all of our frontline workers who have been putting themselves at risk, still putting themselves at risk. Think of them as well when you're deciding to put on a mask or not. There's people that have to work to keep our society going, and if not to protect yourself, then wear a mask to protect them. That is the compassionate and neighborly thing to do. So before we wrap, Dr. Smith, anything that you want to add in a closing remarks?
Well, I'm really very proud to be the health commissioner of Ulster County for sure. I think, when we look at the response, volunteer response, the personnel that work for the county who've responded and are there, as you said, to set this up, to support our community in as many ways as we possibly can. There's so much to be proud of. It's very gratifying, and I want to say thank you to you as well, Pat. I mean, you stepped into the position with a pandemic ready like a tsunami, but handling it as so well and managing the challenges that have come up and adjusting to them and getting ahead of them and making things better as we go along. We've learned a lot, all of us have, and I think we'll be better for it ultimately. So we all need to just keep up the effort.
Yep. Well, again, thank you, Dr. Smith. We'll always keep you all updated as we learn more about the variants. We'll continue to update everybody. And thank you for taking the time. I hope you get a chance to enjoy the beautiful weather today. I think it's going to tip over 70 degrees. So being outside is safe and healthy in many dimensions. So please get outside if you can.
Yeah,
have a good weekend. An early happy Passover to those celebrating. And we will see you at our next update Tuesday, 3 p.m. Until then, be safe and healthy and resilient, and have a good weekend.